turning up the volume on the TV louder and louder, or saying, "What did you say?" I say that often to the person next to you. With back to school season, many kids get their annual hearing test in the classroom, but most adults do not make a hearing test part of their annual health checkup, me included. So here to tell us why it matters is the Director of Audiology over at the Livingston Hearing and Aid Center. We've got Dr. Hunter Gerhart joining us. Thanks so much for being here. We appreciate it.
Thanks for having me.
So first off, tell us why it is so important for people as they age to be proactive with their hearing.
You know, hearing is what connects us to the people in the world around us. And so when we're not hearing things as well, you know, that creates difficulties with relationships, conversation, but most importantly, it increases the risk of cognitive decline. So we want to prevent things like Alzheimer's, dementia, and it's the only modifiable risk factor for those is untreated hearing loss. So we want to stay on top of that and, you know, make sure that we're treating hearing loss when it's there to prevent those things from happening.
So let's walk us through kind of what that looks like, right? As kids, we remember, right, didn't you like raise your hand? What side? Okay, left hand, right hand. What does it look like for adults?
You know, we still do the pure tone test, just like our kids do in school, that screening test, but diagnostic evaluations are a lot more than just tones because we listen to a lot more in daily life than just tones. And so we test to see how well our patients are understanding in the presence of background noise, but also just how they're understanding conversation at a normal level, soft level, and with amplification.
So at what point should you go get a hearing check? Because I feel like so many of us, we've got, maybe it's you, maybe it's your spouse, maybe it's your dad, and you're like, oh my goodness, you cannot hear. And it gets frustrating for the whole family.
Absolutely. I've always said that hearing loss doesn't just impact the individual, it impacts the whole family. And just like you said, when you're having to repeat or the TV's up louder, those are all signs that it's time for a hearing check. But really, you know, we get our teeth cleaned every year. We go to the optometrist every year. And you should also be going to the audiologist every year to have your hearing checked and you know, get a baseline and make sure that there's no changes over time.
So even if I don't need hearing aids, I should still be going to visit you or somebody every year just to get that checked?
I recommend to, yes ma'am, just so that we can keep on top of things and make sure it doesn't get bad.
Let's talk a little bit about ages, and I know it varies person by person, but when do we kind of really start to see that decline happen?
You know, most commonly I see in around age 50 or so is when that decline starts happening, but it can happen at any age. You know, hearing loss is cumulative. It kind of occurs over the course of our life, and so different things like noise exposure and things like that can also impact when people start having trouble, and that's why it's important to protect your hearing as well.
So speaking of noises and volume, it's almost football season, right? I think so many of us, we put the TV on so loud. What do you want people to know as we're watching games, whether we've got pretty good hearing or maybe we're so hearing?
Well, you know, especially if you're at the games too, it's important to protect your hearing because most sporting events can reach over 95 decibels. And if you're around that level of noise for longer than an hour, it can become hazardous or harmful to your hearing. But, you know, I'm not saying we can't enjoy the game. Let's just, you know, reduce that volume a little bit. And, you know, if you're watching it at home, definitely turn it up and enjoy it. But my rule of thumb is no more than 60% of the volume for longer than 60 minutes. So just be mindful of that as we're enjoying the games this season.
My mouth, I'm like, I've never heard that. Okay, say that one more time. And if you're an avid sports watcher, listen, because I feel like that's important. What was that stat?
So 60% of the volume for no longer than 60 minutes.
Okay, there we go for watching football. This is a random question, but some people, you know, use the Q-tips every day, clean the earwax out of their ears. Are you against that?
I am. Okay. So our ears are self-cleaning. All that wax should come out on its own naturally, but when you put a Q-tip in there, it just pushes that wax further down in to where it can't come out on its own. So it's definitely best to avoid the Q-tips if you can, and if you suspect that you have a wax buildup, that's something that we can help with at Livingston as well. We have 10 locations all throughout the Phoenix area and, you know, have video otoscopes where we can show you exactly what your ear looks like and what's going on in the ear canal, and if there's any wax or anything, we can remove that.
Okay, because some people over the years, you just and then you just wonder what is that buildup back there. This was really interesting. I suffer from some hearing loss, it seems like these days, so especially with this little IFB that we all wear. So this was very applicable, and hopefully it helped a lot of you at home as well. Thank you so much, Doctor. We appreciate it. You're welcome back anytime.
Thanks for having me.